So what's the one big factor that determines how well someone recovers from a joint problem? Let's say they have a shoulder surgery or a hip surgery or something like that. So the one big factor is whether they get the problem because of an overuse of the joint versus an underuse of the joint. So as a physical therapist and former strength and conditioning professional, I've been working with people for over 20 years with injuries. And the one big pattern I see is that people who overuse their joints recover much better than those who get the problem because they underuse their joints. And you may possibly get a joint problem whether you overuse your body or underuse your body. Either way, you may get a joint problem. And so your ability to recover from a joint problem will be more determined based on what did you do over the past many years before the joint problem occurred, because your body will be stronger, possibly more flexible, and will be able to sustain a rehab process or a surgery much better if you got the problem because of overuse, or if it wasn't because of overuse, if you just got a joint problem to begin with. And basically, if you are more physically active, if you exercise more and you get in the weight room, you're stretching, you're taking care of your body, and you're more active in general, your ability to undergo a joint problem is much better, and to recover from that joint problem is much better compared to if you are more sedentary and you developed a joint problem because of a lack of use of the joint, or again, because of random circumstances. So the solution: exercise more, be physically active, get after it, get in the weight room, work with a strength training professional, work with a physical therapist, get out there and walk on a regular basis, do whatever you can to use your body more, and you will be more likely to be able to recover better if you use your body more instead of less. And this is a pattern I've seen throughout my life as a professional, both on the fitness end and also as a physical therapist. In fact, the evidence well supports that if you undergo a rehab process before a joint replacement, then your outcomes are so much better, to the point where now it looks like that insurance and Medicare are beginning to require a rehab process before a joint replacement. That means that the evidence is overwhelmingly in support of rehab before a joint replacement. And it's not just with the joint replacement, it's any type of surgery or any type of joint problem. If you used your body more, then you are more likely to recover better compared to if you did not use your body enough.